By the way, the course material for today's webinar, I already share in the WhatsApp group. So everyone can check over there. So I think there's 1 minute left. So I will start today's webinar. So good evening, everyone. Today we are honored to have Professor Ying Wang join us for an online discussion on why abdominal diagnosis acupuncture is necessary for treating neck and shoulder pain. First of all, please let me introduce Professor Ying Wang. Professor Ying Wang graduated from the Department of Acupuncture at Shandong University of Traditional Chinese Medicine in 1990. Acupuncture at the UK Academy of Chinese Medicine, a distinguished clinical expert in the first cohort appointed by Beijing University of Chinese Medicine, and an honor expert in the 16th Xingling Treasure Hunt event at Guangdong Provincial Hospital of Traditional Chinese Medicine. Additionally, he serves as the Executive Vice President of the Overseas Alumni Association of Shandong University of Traditional expert at the French Traditional Chinese Medicine Association and a distinguished clinical expert at the Swiss University of Traditional Chinese Medicine. He is also the head of the Overseas Acupuncture Technology Development Team, Acupuncture Dream Factory. So he dedicated to global promotion and training in abdominal diagnosis acupuncture and published many articles. Abdominal diagnosis and acupuncture involving using palpation of the abdomen to identify positive signs and then selecting corresponding points, acupuncture points for treatment based on these signs. This is a simple and practical diagnostic and treatment methods that can be applied across various clinical disciplines, enabling practitioners to confidently adjust of clinical conditions and improve their practice. Professor Ying Wang.
Hello, everyone. Welcome to join to today's lesson. Today's topic, we will talk why abdominal diagnosis is the key to treating neck and shoulder pain. Neck and shoulder pain is a common clinical condition, and I believe each of you has your own method for treating it. Some focus on local treatment, while others use distal treatment approaches. The treatment methods include traditional acupuncture, trigger point acupuncture, balance acupuncture, massage, bone manipulation, gua sha, cupping therapy, herbal plasters, and herbal medicine. Among others, in most cases, this method achieves good therapeutic results. However, have you ever noticed that sometimes, even when treating the same area and the same symptoms, use the same treatment approach, the results are not as effective, or that even if the symptoms improve initially, they tend to relapse quickly. Why do some patients experience significant improvement after just one treatment, while others with the same symptoms require multiple sessions and still struggle with recurring issues? Have you ever taken a deeper look into this question? I will share two cases of treating neck and shoulder pain to show you and what the therapy I use to treat the neck and shoulder pain. We see the first case, neck shoulder pain related to heart disease. I think probably you don't listen. Oh, the neck pain, shoulder pain is related to heart disease, but it definitely some neck and shoulder pain is related to heart diseases. And we treat the heart, so we still can, to treat the neck and shoulder pain as well. So say this case. In a 2019 training course in Shenzhen, a student asked me to help treat her cervical spondylosis. She had been suffering from neck and shoulder pain for many years and had been treating herself, but without success. Upon inquiry, there was no record for any significant previous medical history. I asked her, she said, "Oh, I'm healthy, no other medical problem." But during a routine abdominal examination, I found that in addition to general abdominal signs, almost all heart reflex zones exhibited tenderness. This raised a strong suspicion that the patient might have an underlying heart condition. Upon the further questioning, she revealed that she occasionally experienced heart palpitations and an increased heart rate. So we found the abdominal sign, the positive abdominal sign first, and do the further inquiry. So the student tell me she occasionally experienced heart palpitations, and sometimes, the heart rate is faster. I then considered that her cervical condition might related to the heart disease. To verify this, I conducted an immediate examination, which confirmed my suspicion. How to do the test? In our class, we will teach all the details. So how to test if patient the neck and shoulder conditions is linked to people's heart problem. Okay. So based on this, I applied acupuncture to 三阴交 spleen 6 and 阴陵泉 spleen 9 on both sides. So these 2 points can treat heart conditions. Afterwards, I asked her to move her neck and her pain was significantly reduced. She moved her neck. She felt, much better. Additionally, all abdominal signs showed varying degrees of improvement. In the second step, I continued with corresponding treatments to eliminate any remaining abdominal signs. By the end of the treatment, all signs of heart-related issue had disappeared, and her neck discomfort was completely gone. You see, this is the result of our abdominal treatment. On the third day, I followed up online, and she reported that her neck still felt very comfortable, and the result were highly satisfactory. So, if we didn't find the heart problem, the abdominal signs in the heart zone. So we will not know the people's neck and shoulder problem is linked to the heart. But after we do the abdominal checkup, we found the heart positive signs. And then we did, verified test and proved my judgment. And then we do the treatment. So the result is very satisfactory. So we see the second case. This case is reported by my student. Case 2, neck shoulder pain related to thyroid disease. You see, maybe make you surprised. Thyroid is in the front of the neck. Why? The neck shoulder pain is caused by thyroid. But in the clinic, there are a lot of people's neck shoulder pain is related people's thyroid disease. The important things you should know how to diagnose it. Let's see the case. The patient is a female, 50 years old, shift complaint, neck and shoulder pain. The patient received a massage yesterday, but the effect was minimal. Physical examination, swelling on both ringing point, stomach 9 point, with significant pain on the right side, tenderness at the C6 to C7 Huatuo points, tension on the left side and tenderness at the Dazhui do 14 points area. Tenderness at the both long 10 points. The medical history, people is irritability, mental tension, poor sleep, and prone to agony. So the diagnosis, neck shoulder pain caused by thyroid imbalance. So the treatment, 3 needles behind the ear. Okay, this is a group of points. We called 3 needles behind the ear. So during the offline lessons, we will teach where the 3 needles behind the ear's location. Okay. After needling and mobilizing the neck and shoulders, the symptoms were significantly relieved. The previous tense signs improved. The pain at both stomach 9 points, ringing point, disappeared. Tenderness at the C6 to C7 Huatuo points was reduced, and the tenderness on both long 10 area also lessened. The needles were retained for 30 minutes, while simultaneous applying gentle massage to trigger points. Let's see the result. Shift complaint of the neck and shoulder pain was completely resolved. The Yuji point, long time tenderness disappeared. The patient was surprised to learn that her neck and shoulder pain was related to thyroid inflammation. He said the patient before she didn't think about, the neck pain caused by thyroid. But the treatment is focused on the thyroid treatment. After we treated the thyroid, ringing point tenderness disappeared, and the pain on the neck disappeared as well. She was very pleased with the treatment scene. This acupuncture session was exactly what I needed. It's reported by my student Wang Qiuhong. Okay. Key takeaways from these 2 cases. Neck and shoulder pain is not always caused by local cervical spine issue. The underlying causes of neck and shoulder pain may be related to the patient's past medical history or abdominal muscle tense and injury. To determine whether the patient's medical history or abdominal muscle injury is the true cause of their neck and shoulder pain, we can use abdominal diagnosis for precise differential diagnosis. So whether people's the previous medical history is related to people's neck and shoulder pain, we can use our abdominal diagnosis for precise diagnosis. Okay. So this approach allows us to select the most accurate treatment leading to the best therapeutic outcomes. So in the book, uh, the true, the true essence of acupuncture, Chinese name is 针灸真髓. There is a passage that states in Chinese medicine, regardless of the disease, the primary principle is to treat and heal the internal organs in the abdomen first. Additionally, conditions affecting the head, face, and limbs will naturally resolve as the internal organs in the abdomen are regulated and restored. So this means most time after we treat the internal organs, when the internal organs be treat and healed, other part of problem, example for the head, neck, shoulder, limbs, back, sometimes they will follow the organs, follow the when we healed the organs, these symptoms will be healed as well. Sometimes you don't need to do any further treatment for other parts of the body. So this is what I want to introduce to everyone to treat internal abdominal organs first. Okay. In the Nanjing, chapter 16, Nanjing is classic of difficult issues. Okay. It also distinguishes between internal and external manifestations to disease. Treating internal conditions follows the principle of addressing the root cause of the illness. You see, treating internal conditions follows the principle of addressing the root cause of the illness. Our modern abdominal diagnosis acupuncture is precisely a therapeutic method developed based on the abdominal diagnosis principles in the Nanjing, aiming to treat diseases by addressing their root causes. Okay. Let's say ADA treatment is abdominal diagnosis acupuncture treatment stresses for neck, shoulder disorders. So this what we treat diagnosis and treat the neck and shoulder pain. First, conduct the patient interview. Inquire about the location of the pain or discomfort, the characteristics of the pain, episodes, and any past medical history. Second, perform comprehensive physical examination of neck, shoulders, lower back, and back with a special focus on the primary pain area. Third, conduct a throughout abdominal diagnosis to assess potential internal imbalance. After completing the above examination, record all positive findings, which will serve as the basis for both treatment and evaluation of treatment effectiveness. The first step of the treatment, eliminate abdominal signs. Start by addressing the 4 primary abdominal signs. Then eliminate abdominal signs related to the shift complaint and those associated with the patient's medical history. 5. The second step of the treatment, distal therapy. Use distal acupuncture to eliminate any remaining symptoms in the neck, shoulders, lower back, and the back. Alternatively, applying holistic treatment to correct structural imbalance in the back. So this step we all will teach you in our offline class. 6. The third step of the treatment, local therapy. Perform localized treatment to address any remaining symptoms in the neck, shoulder pains, shoulders, lower back, and back. This is the whole process what we use to treat and neck and shoulder pain. So let's see the other causes of neck and shoulder pain. Before, when we talk about neck shoulder pain, we always talk about the cervical spine problem, local muscle problem, but others problem include the abdominal muscles is very important. Let's see the tension and the contraction of abdominal muscles, including the rectus abdominis, oblique muscles, and psoas major, can cause the head and neck to tilt forward, stretching the neck muscles and leading to the neck and shoulder pain. And then the surgical scars on the abdomen can also contribute to abdominal muscle tense. So if I stand up and see, if I pull my clothes in my tummy area, I will feel my head will tend to tilt forward. Okay, if we do this for a long time, the neck back muscle will feel very tense and cause the neck and shoulder pain. Okay, it's the same reasons when the abdominal muscles have the problem, it can cause neck and shoulder pain. Let's introduce some I'll give you some example, different area, neck, shoulder pain is linked people's abdominal muscle problem. Let's see this picture. So pain in this area, see the green circle, yeah, this area. Pain in this area is often caused by the blood stasis and obstruction. Upon examination of the liver reflex zone uh, in, in the abdomen area, we will find people's liver reflex zone. We will typically find abnormalities such as tension, tenderness, or nodules, nodules on liver reflex zone. So if we want totally kill the pain in this area, we need eliminate any positive signs in liver reflex zone in the abdomen. See, if pain in this area, in 大椎 to 14 area, if related to an immune response, so this area we could cause by the immune deficiency. Okay, it will present abnormalities in the lung reflex zone during abdominal diagnosis. Yeah, we will find some the positive signs in the lung reflex area. If it associated with thyroid imbalance, abnormalities can be found in the thyroid reflex zone upon examination. Like the second case I gave to you, when we found thyroid zone have the tender and tenderness, we believe the neck and shoulder pain in 大椎 area is related to thyroid imbalance. Okay. A hump at the base of the neck in 大椎 area, commonly known as a wealthy hump, it is related to fat metabolism imbalance. And abdominal diagnosis will reveal abnormalities in adrenal reflex zone. So when we treat, the wealthy hump, we not only treat the local, we should treat the adrenal reflex zone as well. This is a root treatment. Okay. If we have the pain in this area, you see people have the pain in this area, the black colored, and still feel the pain in blood 23 area, 肾腧, and blood 25, 大肠腧 area. So if pain in this area, after we do the examination, we found this type of the pain is often related to the visceroptosis. It's called the organ prolapse and structural imbalance. Abnormalities can be detected in the visceroptosis reflex zone upon the examination. Okay. If neck and shoulder pain is related to diabetes, abnormalities can be found in the diabetic reflex zone during abdominal diagnosis. These abnormalities in the corresponding abdominal reflex zone may be the underlying causes of the neck and shoulder pain. Once these abnormalities are identified, we can use pressing diagnostic points, we call the 揣穴, to verify our diagnosis. Following this, acupuncture treatment can be applied to achieve effective therapeutic result. Now we give you another case, case 3. Pain in the right C3 jiaji point area. Patient female 52 years old, shift complaint. Pain from the right big toe to cervical spine for 2 weeks. The medical history: cholecystectomy and gallbladder removal 10 years ago. Development of 2 hepatic cysts post-surgery. Underwent a partial hepatectomy 2 years ago. The physical examination: neck and shoulder tenderness on the right side of the neck and shoulder, especially at C3 and Jianjing gallbladder 21 point. Lower back and hip, bilateral sacroiliac joint and hip tenderness. Let's see with the red color C3, the pain. Abdominal diagnosis: tenderness over surgical scar from navel to xiphoid process. Right up abdominal tenderness. Tenderness at the lateral end of the horizontal scar on the right side. Tenderness in the immune reflex zone, blood stasis zone, and bilateral inguinal ligament. Tenderness at the 5 points on the right spleen meridian. Post-diagnosis: left twin guanchi pulses are all deficient. Tongue diagnosis: they attach the picture. You see, this patient, they feel the pain, neck, shoulder pain. It's the abdominal diagnosis, scar, you see, okay. And the sacroiliac area, the pain, hip pain, it's tongue, okay. So we see the treatment. First, treat abdominal signs corresponding breath coordination and acupuncture therapy. Second, apply metal water treatment on spleen meridian. Third, perform palpation and shallow needling at the right 大敦 point, level 1 point. This point is treat C3. Okay, so the third step, perform palpation. So for the perform palpation is found exactly which is more sensitive for the 大敦 area. So we need we call the 揣穴. Okay, so we perform palpation and used shallow needle, shallow needling at the right level 1 point. Use the heat-inducing acupuncture technique to make local warm. The patient began to feel warmth in the right big toe with the heat sensation spreading up to the lower abdomen. However, the left big toe retained cold throughout the process. The treatment result. Above the treatment, abdominal signs showed significant improved and tenderness at the surgical scar was greatly reduced. When moving the neck and right side, the pain disappeared, but the patient started to feel discomfort on the left side of the neck. The fourth step. The patient was then asked to lie in the prone position to continue acupuncture treatment for the structural adjustment. Pain in the bilateral sacroiliac joint and hip joint disappeared. Left side neck also showed significantly improved. The final outcome. At the end of the treatment, the patient stood up and walked, reporting noticeable reduction in the pain in the right big toe as well. Finally, the patient scheduled the next treatment session and left happily. So this treatment is we use starting point to treat C3. So now I will explain why starting point level 1 can treat pain in the C3 and C5 jiaji points, jiaji area, the pain. We can see this picture, okay? The right side C3 to C5 area, the pain. So when people tell you they got neck pain, you need to check where the pain is. If we found right side C3 and C5 jiaji points area is very, very tenderness, okay, we should think about we use starting point to treat this. Why? Because from C3 to C5 is a phrenic nerve come from originate from here, the phrenic nerve. So we see this. So if we found the pain in right C3 to C5 jiaji region, we should know this area is phrenic nerve originated from C3 to C5, terminates at diaphragm, and then is connected to the liver. And after we do the abdominal checkup, we will find dysfunction in this area can lead to liver deficiency syndrome. So we do abdominal checkup, we should find, okay, liver deficiency sign. So the treatment, the followed treatment is we select the 大墩 points, level 1 point. The level point, the wood point of level meridians, we know the 5 shoe points. Wood is the first one for the level 1, okay, to nullify the level. So we use wood point to tonify the wood liver. This treatment will simultaneously addressing liver deficiency syndrome and relieve the pain in the right C3 to C5 jiaji region. So if we do the very precise diagnosis, you found C3, C5 have the pain, still found a liver deficiency, so we choose the liver 1 point. After you put in the needles in liver 1, you can immediately go back to check liver deficiency sign will better, and since the pain in right C3 to C5 jiaji area will better as well. So the real result is very, very quick. Very, very quick. Okay. Let's see this case. This lady, neck and shoulder pain for 6 months, accompanied by restricted shoulder joint movement. You see this area. Okay. And after checkup, you see, yeah, this pain here, Hui2 area. Okay. From the kidney meridians, yeah, this Tanzhong points, this long 10 points, and we still found the lung area, inguinal ligament, abductor muscle in the thigh. Okay. So after we do the checkup like this, we did the mark. So we know where the people's problem is. So this patient, after we do the diagnose, so we just follow our diagnose to the treatment, and the pain immediately feel much, much better, and the shoulder movement much, much better. Okay. The last we do the conclusion. Abdominal diagnosis acupuncture provides a holistic treatment approach that addresses the root cause of the neck and shoulder pain. It can be applied to a various type of the neck and shoulder pain in clinic practice. This method works quickly, delivers long-lasting results, and reduces the likelihood of recurrence. Make it a valuable technique worth learning and applying in treatment. So this method is worth everyone to learn. It will give you a big help in your clinic practice. Today, we have briefly introduced several diagnostic and treatment approaches for different types of the neck and shoulder pain. In our offline course, I will provide a detailed explanation of the diagnostic examinations and treatment methods for all types of neck and shoulder pain. I look forward to seeing everyone in our offline courses in this April in Malaysia. Okay.
Yeah, in Kuala Lumpur, Malaysia, we'll have invite Professor Ying Wang to come to Kuala Lumpur, Malaysia to have an abdominal diagnosis course. in April 25th to 27th. Thank you very much for Professor Wang sharing his valuable knowledge with us. And if anyone has any questions, you can type your question in the chat box now, and we will answer you one by one.
Look.
Okay, so I have one question here from Dr. Yusran from Indonesia. He is asking, do you always use burning mountain technique? That means it's warming 烧山火 methods after you
We use
insert
this,
the needle?
the heating method. We not use it in every needle. We just choose some the important needle. It's enough. Okay, because what we do, we just start this function. So, for example, if we do the rainfall Guanyuan points, we do the burning mountain technique. We call the heating technique. Okay, the worm can spread itself. It can spread to the head, to the feet, leg feet, to the back. So you don't need to all the needles. You choose the most important one. Do one or two is okay. Yeah.
Okay, the next question is, when you talk about the pressing diagnostic points, are these acupuncture points or any Ashi point?
Pressing.
Pressing diagnostic points means that Professor Wang's first diagnosis with the abdominal, we have different zone because we already introduced this in our first webinar, this part one webinar, introduction of abdominal diagnosis.
Yes, it's
So
not ask points. Yeah, not always. We got some area.
so which means that I will share the part one webinar, with everyone later in our group. So the diagnostic points is according to different zone in our abdomen. Yes.
Yeah, the four.
And
This is what's the four primary abdominal signs. The four primary abdominal sign is the liver. Yeah, the liver reflex zone we need to treat. Yeah, because the liver is also called the blood stasis zone area. So we should remove the blood stasis first, and the kidney area or adrenal area is second. Okay, and
all
third
this we
is the lung.
already
Yeah,
mentioned.
yeah, the lung is third, and then the spleen and stomach. Okay, these four primary abdominal signs.
Okay, the next question is, first step of treatment, eliminated abdominal signs, start by addressing the four primary abdominal signs. What are the four primary abdominal signs? Just now, Professor Yin 四大治疗原则，他的意思是说。The four primary abdominal signs is we check the zone like gastric area zone, liver zone, lung zone, and the kidney zone. This is the four primary abdominal signs we need to check for our patients. So any other question? More question? No? Okay, does every patient have abdominal signs? Professor Yin. Wow.
Yes, in my clinic, every patient I do the abdominal checkup. How about the treasure? Treasure is means, yeah, we found exactly where the point is. Because when we do the acupuncture, okay, we are not always follow the location in the textbook, follow the textbook. Okay, but not always follow textbook. I need use my fingers to bond, to touch the, the point area, use the pressure, different direction to test which direction, which spot can reduce the pain most. So I choose which spot. So we call the 垂穴. Okay. It can find exactly the point.
Can we treat coma patients by these methods? This question from another doctor.
Coma, because
When
the coma, we don't use
patients
this
by this
in coma patient because they can't do any, response. Okay.
Okay, is there any more question? One of the doctor is asking where is the diabetic reflex zone? Diabetics reflex
Yeah, I will
zone.
teach in the offline class. Okay. We will teach you. Yeah.
Can we use the abdominal diagnosis to treat Parkinson disease?
Yes, we can use because Parkinson's is the brain have the problem. We always say the abdomen is second brain. So we can use the abdomen to do the treatment to help the Parkinson's and brain problem. Okay, like stroke, the Parkinson's, yeah.
So any other question? For those participants who haven't joined the first webinar, the introduction of abdominal diagnosis, I will share it later in the group with the PPT provided by Professor Ying Wang together. And you can go through
use in the children, yeah, no problem. Because if you do the examination, children still can, feel pain. If she feel pain, you can see the children's face. Okay, if she feels the pain. Oh, what's wrong for the? Yeah, we can do that in the children the same method. Okay, no problem.
Question? Hello?
Hello.
Yeah, any question?
Well, yeah. For abdominal diagnosis, so we don't use the pulse diagnosis, isn't it?
Yeah, normally we don't need to use the pulse, but you can use pulse as well.
Oh,
Yeah,
so we
because
can combine. Hello?
you think
We can combine.
you can just use the abdominal diagnosis first, or you can use two together. No problem.
Okay. Okay, thank you.
Welcome.
So if we'll go through the other part. Okay, there's another question. Is it possible that patient has abdominal size has multiple cough dictions? pricing. Can you please open your mic and ask your question?
Multiple, what's that?
Conditions or conditions. Okay. Is it
Yes.
possible that patient has multiple conditions?
No, for the abdominal signs, because this is the root for the patient. So the patient, the same conditions can cause different symptoms. Okay, so different people probably they have the different disease. Some of the previous disease, some of the current disease, and some will, will happen maybe in the future. In future, 1 or 2 years will happen. So the abdominal signs can, how to say, can tell us, and people probably have the multiple conditions, not only for one problem. Okay.
准备好了噻。Sorry, any last question? So in this upcoming April seminar, Professor Wang will help every participants building modern abdominal diagnosis acupuncture clinical thinking using on-site patients or participants as models. The course provides a comprehensive demonstration of the practical application of modern abdominal diagnosis acupuncture in clinical practice, along with case analysis and discussion. So the course content focuses on practical clinical applications, combining hands-on practice with in-depth teaching of real clinical cases. It helps everyone quickly develop abdominal diagnosis clinical thinking and apply it to our daily practice as soon as possible. Well, thank you very much for Professor Wang sharing his valuable knowledge with us. Now we have another great piece of news to share with everyone. So let's invite Mr. Christopher Chan from Yongho TCM Center. So he will make the announcement with everyone.
Hello, everyone. Thank you, Dr. Grace. Hello, everyone. My name is Christopher Chan. I'm a director of Yongho TCM. First of all, thank you for Professor Wang bringing such an inspiring and wonderful session to this webinar. Professor Wang's session was not only insightful and engaging, but also deeply inspiring. Once again, we sincerely thank you. Lastly, I have a special good news want to announce to everyone. Our early bird was just ended last week, but still got people come to ask me early bird price. So without early bird price is 5,000. Now, the early bird price has been extended, and the early bird offer has been extended to 31st March 2025. But the condition is you need to make a payment with only 1,500 deposit by end of this month. So don't miss this extra time to grab your special deal. This is the last deal, okay? We're not going to extend it anymore next month. So this is the final final extended. Please act fast, okay? Okay. I just received extra news from the Grace saying that we're going to give an exciting offer and for 150 ringgit cash voucher. So another good news for you, guy. Okay. Wait, let me change the screen. Okay, now you see that so those who sign up this course and pay only 1,500 deposit by 15th of March, mean that you have to pay by next week. So you will get it 150 ringgit cash voucher. And this cash voucher you can deduct it from your cost. So again, don't miss up this special reward. We're not going to give it every time. Okay. All right. I got one more. This is a final amazing deal. All right. Okay. If you refer a friend and if both of you sign up for the course by 15th of March, so you will get additional 150 cash voucher. Right. Okay. So, any question? If you like to have this offer, this cash voucher offer, please write into the chat box. Okay, in the chat box, I want you to write down your full name and your WhatsApp number. Okay. Now, this offer is only limited to give away for this webinar, only 10 person only. So only 10 person we are giving out. Since there's only 10 person, so first come, first serve until we run out. So you must act fast. So those who want this cash voucher, please write it down now in the chat box. Okay, and with your full name and with your WhatsApp so that my assistant can contact you and send you the cash voucher. So yeah, please write it down if you want it.
Hi, everyone. As I know, Professor Wang's 2025 course schedule is fully booked worldwide. So in March, Professor Wang will teaching in Taiwan, April, China, Malaysia, June, Hong Kong, August, USA, and November in Australia. But in Malaysia, is the only English class will be only abdominal diagnosis class will be conducted in English. So if you want to learn it from Professor Wang, please act fast because seats are filling up fast. So secure your spot now and be part of an enlightened global learning experience with Professor Wang. And also,
Okay, guys, this is our contact number. So who want to contact us for the voucher? Okay, you can still come to us. So you can WhatsApp us. This is all the number. You can take it down, or you can snapshot and then WhatsApp us. Okay, if you want this voucher, we will send it out to you. Okay. Grace, you got anything to say?
yeah, The course content for these 3 days will emphasize how to perform abdominal diagnosis examination, how to use breathing techniques to relieve abdominal symptoms, how to flexibly apply various treatments based on the conditions, and also how to communicate with patients from the perspective of modern abdominal diagnosis acupuncture. We hope that more physicians can participate in and learn from this course, thereby helping more patients, enhancing their own skills, and achieving substantial economic benefits for their clinics. In addition, Professor Wang will also mention how to use the mental and water therapy for each meridian in this coming April seminar. Of course, the content on how to use abdominal diagnosis acupuncture to treat neck, shoulder, and lower back pain is also included in this course. So as we all know, the internal organs are concentrated in the chest and abdominal area. When a problem occurs in a specific part of the body, it can generally be reflected in the chest and abdomen. Therefore, during treatment, abdominal diagnosis allow us to make a more precise differential diagnosis, enabling us to choose the most accurate treatment and achieve better therapeutic results. So in these 3 days, Professor Wang also will teach us the cooling methods and also the warming 烧山火 methods. So the cooling methods can help patients relax, relieve stress, and fall asleep quickly. This method was originally created by Professor Ying Wang. And the warming 烧山火 can warm our body, promote the recovery of our vital energy, 正气, warm the lower jaw, and facilitate the restoration of our 元气. So this is very helpful for us as clinical practitioners and benefits our patients. So if anyone would like to join Professor Ying Wang April seminar in Kuala Lumpur, Malaysia, can always come to me, and everyone who participate in this webinar, you can get the offer as just now Mr. Christopher Chan shared with everyone.
Yeah, I can see the chat box here. Mute 掉了。Yeah, I can see a chat box here. Hi Sing. Hi Sing, please write down your name and your WhatsApp number in the chat box so that I can contact you with those voucher offer, okay? Otherwise, I have no idea how to get through of you, okay? I got here Dr. Shalish. Right, okay. We'll write down your name and your WhatsApp number. Make sure this number can be WhatsApp so that we send you those voucher through your WhatsApp. Anyone else? I give another maybe 5 minutes, 5 to 10 minutes before we're going to end this meeting.
Okay, Dr. Saleh. Okay, Dr. Saleh, assistant will contact you. He already record your WhatsApp number. Okay, there's another participants. Okay, Dr. Surendra Patel. Okay, both participants from India, welcome to join us in the April seminar to meet with Professor Wang. Thank you and welcome to join the seminar.
那我先下了哈，Grace。
好的，好的，可以了，
好的，
Okay.
谢谢老师。
嗯，
Okay,
4
you
月
can
见
take
哈。
down the name, the number contact. Okay, or you don't want to write down the name. Okay, so you can contact us also for those voucher. I put down our contacts here. You can contact through us through a WhatsApp if you want to get a voucher. Otherwise, I'm going to end the meeting.
You can also refer this course to your friends and you will gain the 150 cash voucher. You can use it in the next seminar. Also, no problem. So we'll end the seminar. 5 minutes later. I just want to do some little bit sharing with all of you. If you learn the warming 烧山火 or the cooling methods, it's very useful in our daily practice. As I will show the video with all of you for my students, they really feel very relaxed and can sleep. For those insomnia patients, after I did the cooling methods for them at the yin tongue place here, they really can feel very relaxed. So for those patients very stressful and insomnia patients, it's a great help for them. And also the warming methods. The warming methods is very good to build up our yuan qi, build up our zhen qi, give us power every day facing our patients. And also Professor Ying Wang is very kind. He's a very kind expert. And he will share everything he knows with those students. Yeah. So you can ask any question with Professor Ying Wang. He will answer you. No secret, no hiding. So if you can come to join us and this April 25th till 27 April, Friday, Saturday, and Sunday, I hope to meet all of you in Kuala Lumpur. So I'm waiting for doctors to contact me. So we'll end today webinar. Thank you, everyone. for taking the time to attend today's webinar. We hope to see you soon. Thank you and goodbye. Have a nice day.